Morning, everybody. Welcome to staff meeting Tuesday, January 21st, on a cold day. So glad everybody is here. Tom, take it away.
Yep. Good morning, Chairman and Commission. We have three topics for staff discussion this morning. Dr. Brantley is here from Extension Center. We'll let her go first, and she's brought her Director of Extension along with her. The second topic will be Jen Wilson's here, and Andrew Dills and a representative from Helix Architecture is here to give the commission an update on the ComCare Crisis Center that's going on right down the street here. And then the last part of the meeting, we'll save some time to discuss what's an agenda item for tomorrow, the guardrails on sales tax, property tax. So with that discussion. So we'll start with Dr. Brantley though, and she will take it away.
Good morning. Welcome.
Well, thank you. Thank you for the opportunity to be here, commissioners and county leaders. We felt like it was, if we could have an opportunity to just kind of share a little bit about how your partnership with us is very important, and to share with you how your funding with us is important, as well as, you know, what we are doing and what we're doing to move forward in the future. So we gave you packets, and in that packet, looking on the right-hand side, I wanted to start with the organizational chart and to let you know that even though when we come in and talk to the commission about our programming or anything like that, you usually meet our agents. We have right now 8 agents, including myself. We usually have 9. We have the adult development and aging agent position open right now, the person who oversees the SHIC program, the Medicare counseling. So usually we have 9 agents. Myself and the 9 agents, we are considered K-State employees. So we get K-State benefits and whatnot. And K-State kind of reimburses us a percentage of what we pay for the agents. Everyone else, well, not everyone else, but the hourly, you know, the program managers, office professionals, those are paid for by our extension board. And Janet Sprecher is here as our board chairperson today. And then we also have federally funded positions, such as those SNAP Ed positions, the FNET positions, and of course, the SHIC positions are funded through PayDads as far as that goes. But the agents and the hourly professionals, we depend on what we receive from the county to pay sufficiently. So then if we go on, well, I think that the next page it just shows kind of the longitudinal budget numbers that we have received from Sedgwick County from 1993 to 2025. We received increases, and then we were steady from 2014 to 2024. We received 825, 481. And then, you know, we received the cut for this year. So we just wanted to show that the increases were appreciated. We've been steady for a decade, and we've been able to shift things around and pay our people sufficiently so that they don't leave too fast. But with continue.
What'd you say, Dr. Brantley?
Okay.
Why don't I think we can keep pushing through, but this might be a bit annoying. So, Tom, why don't we hang on, because this is important. I don't want any distraction. Yeah, let's take a break. Kevin, let's take a quick break, and then we'll hang tight.
Oh, and it sets it off. right. Fire knocked them out.
Hey, you tell us when we're back on? We're on, okay. Dr. Brantley, just a slight interruption, so.
I was saying, you guys are fun.
All right, go ahead.
All right, so I was talking about the 32-year funding and looking at that sheet. But then over on the next sheet, you'll see the budget for Sedgwick County Extension Council. This is 2025. We have to submit this in July. And for those of you who have been chairs, you sign off on this. And this is just kind of our general budget that we submit. And so if you look at this, nothing superfluous. We have salaries and wages at $853,000, which is, pretty good for a staff going back to the organizational chart. When the county talked about the cuts, we had to resubmit this and cross out our original allocation. And the unencumbered cash balance is the amount of money that we have to come up with through sponsorships or, from other places. And so that's the issue. And so when we were talking about, we don't know if we're going to be able to hire another agent at this point. And because someone left from our adult development aging position, the SHIC position, and it's a very important program. And we definitely don't want to drop it because I feel like people see the extension services as very important and they appreciate it. But, we had to kind of wait and see what we could do, shovel some money around and stuff to see if we can afford. We are going to post this position here at the beginning of February, and we are going to hire that position nonetheless. So this is an example of the budget. Also, I wanted to point out our impact report. This is something that we just put together, the agents and I, and this just highlights some of the major programs that we've done just in this past year. This isn't everything, of course, but this is the stuff that we felt like would be interesting to you all in Sedgwick County and what we have done to help partner with not only Sedgwick County offices, but other important partners and organizations within the community. So it's our goal to continue to do that. It's our goal to continue to work with the county. You'll notice on the talking points, that first page, ways that you all provide for us. If you weren't in the know, we have extra rooms in our building and we rent those out and we're able to keep that money. They're free to county employees and to county departments and events. But anyone else who wants to sponsor a birthday party or something like that, we charge them for it and we're able to keep that money thanks to some agreements that were made right before I was hired. And a couple years later, Tim Kaufman helped to make the IT support. He's like, why are you paying for a third-party group when you could be under IT? And so we've been able to appreciate the support from Sedgwick County IT. And then what we do for the county, we just kind of listed a few things there. Because I'm sure you could probably say, well, what have you done for us? And so we wanted to list some of those things as well. And so I am going to hand the mic over to our board chair, Janet Springer.
Hey, Janet, welcome.
Thank you. So my name is Janet Sprecher, and I am the chair of the Sedgwick County Extension Board. This is my second year in that position and my third year on the on the executive board. And we are a 9-member board. And if you look at in the back of the impact report on the very back page, is at the bottom is a list of the board members. So we're 9 members, and we represent several different places across the county in several different communities. We just wanted to make sure, as a board, we obviously have to deal with the budget, and we obviously have to deal with budget cuts. And so we wanted to make sure that we had a opportunity to talk to you this morning about making sure we're at the beginning of the 2026 budget process and making sure that we have a discussion with you prior to that whole process starting, so that we can discuss any potential cuts, further cuts. The 10%, as Dr. Brantley talked about, we have taken that into account in our planning processes, and we've worked around that. But we do have concerns about any future cuts that could potentially be coming from the county allocation. So I just wanted to be a voice of the board, of our extension board this morning, and as we come before you to talk about the programs of the extension program. So with that, I'll turn it over to Greg Hadley, who's our state extension director.
Good morning, everybody, and thanks for all the excitement this morning. It reminded me back when I was still in the classroom and I had a difficult test to give, and suddenly the fire alarms would go off. It was interesting. But I just want to say an appreciation from the state for all that you do, all the support that you give to our extension. I know that you have a lot of tough decisions and to make regarding budget allowances and things like that. And I'm just here to make your job a little bit harder. And so we are in a very unique, great state. Lots of times when you have my counterpart in extension, it is a very top-down type system. And in Kansas, we have this whole thing that it is very much a cooperative system where we work together to deliver extension. And our boards here are actually governing boards. And so we co-govern our local units together rather than in a top-down manner. And things have been going very well in extension across the state. We've had phenomenal growth with regards to direct and indirect educational contacts. About coming out of COVID, we're right at about 1 million total contacts across the state and about 2.5 million. The 23-24 programming year, our total direct and indirect contacts have raised to 8 million. And that's largely due to online things. And so we are really doing a great job. One of the things that Sedgwick County does, Sedgwick County Extension does that they're well known for is their volunteer programs. They have, and I got cheat sheets here, so that's not off the top of my head. But anyway, 43,000 volunteer hours just emanating from Sedgwick County, and that dollar value on that is well over $1 million. And those the contacts made by volunteers is about 105,000, mainly through their EMG program and also their SHIC program. And those are just really incredible numbers. The other thing that's happening at the state level that I think is very positive to the future, K-State has shifted with a new strategic plan. Under previous strategic plans, when we look at engagement, which is basically whenever Extension or anybody else goes out into the communities and help individuals with their problems, K-State said, we've got Extension and they do it, and there's a few centers that do it. Under President Linton, guidance, and he's a extension background. He has an extensive extension background. We are opening that up. And so now, whether you have an extension appointment or not, you are expected to engage in the communities. And so there's going to be a lot more resources from K-State that will be made available, human capital resources, so that we can bring more people into communities to address those problems that we're facing. We had in your packet, we had an extensive needs analysis done, and we did this in Sedgwick County as well. And across the state on this one where it says support critical community needs, those were the major issues when we asked them, considering we are bringing more human capital online to help support our local units, what issues do you want to have addressed? And those were the issues. And these were robust, whether it's a county like Sedgwick County or whether it was a county like Hamilton County. These issues came to the top. And if you switch over to where it says the big 8, and no, this doesn't reference where the Big 12 conference was. It's referencing just that there's 8 things that we would like to double down on. One is broadband accessibility, childcare, higher education access, housing, hunger-free Kansas, leadership development, rural health, and water are the major issues. And so I don't know which of those appeal to you, but if there are issues on there, make sure that you contact Jennifer about it. Feel free to contact me about it. But we just wanted to let you know what to expect in the future.
It is pretty exciting, kind of the directions that we're going. We're going to continue the programming that's popular in Sedgwick County to continue to serve the citizens of Sedgwick County. And then also, offer this type of stuff to move forward. And so we just want to be seen as, Sedgwick County is a nonprofit, I guess, as an extension of you all. If you see something that we can be of assistance, please let us know. And that's kind of where that comes from. Another really neat thing that's in your packet, it is the All Kansas, what's it called? All Things Kansas. This is a wonderful resource. It's put on by K-State 105, I believe.
105, yes.
And this is something that you can go into and get statistics in any of the counties across the state. Examples are, what is it? Childcare.
Childcare,
Infant mortality,
broadband access, whatever. So it's
any kind of statistics. And so feel free to go there. That will be interesting and useful perhaps in any of your positions. But basically, we just want to make sure and present to you all and hopefully share with you what we do. And hopefully you can leave, I guess, understanding and feeling like we are an important partner. And we'll take any questions.
Okay, very good. Well, we appreciate the information in the packets. Dr. Brantley and I met about a month ago and kind of covered some of these same things. I had a lot of questions. So I think this would be a good opportunity if commissioners have other questions. We fire away. Go ahead, Commissioner Howard.
Just looking at, again, thank you for the presentation, Dr. Brantley, and looking at some of the information here. You guys are paying $3,600 a year on rent. That the building, the 21st and Tyler,
That is,
21st and Ridge, I guess.
ooh, look at this. Expenditures, that is, we put in there for the people who room rent and we need to refund their money. We have to take it out,
Okay.
So it's kind of a pass through anyway.
So that you're not paying, so just want to make sure I understand then. So the county does own the building, is that correct?
Right.
And right now, Extension is not paying the county for the access to the building. That's something we provide?
Right.
So is there a value for that we know what that's worth each? Because is it captured somewhere in the budget, somewhere that we know what we're?
It is. So, just so you all know, I'm Lindsay Proverso. I'm the CFO for the county. Nice to meet you. So the facilities department does have a separate fund center that tracks the expenses that are spent on the actual facility for electricity and full-time maintenance staff. And that total in 2024, Lorian was just able to pull, it was just at $247,000. And so that was for the staffing, the electricity and all of that. So that would be essentially the value that we would assign to it per.
So we could consider that in addition to our yearly support. That's something we do provide.
When we talk about support to extension, yes, we do typically have that, but we'll add an asterisk that indicates that that's not a direct allocation that's given to them. It's kind of that indirect support by providing the facility.
It looks like they also have a staff person that's titled maintenance. Is that something that is coming out of your,
No, he's a county employee.
is county employee? Are we paying that salary directly or is that
Part of the 247, right, Lindsay?
part of the 247? Okay. The other members of this org chart, are they also being paid by the county or are these paid for by extension? They have a financial manager, reception. Those are all county or?
Use the county allocation to make the payments to our employees. Yes.
So these 3 employees are extension employees?
Which ones? Which 3?
The financial manager, reception office professional, and the front
Yes.
desk,
Mhm.
but not the maintenance. Maintenance is ours.
Correct.
And I think that's why it's got the dotted line on there, correct? Is
Yes.
because it's the county's.
Okay, I see the dash line now that you mentioned that. Okay,
Yeah.
very good.
Mhm.
Are any of these programs required by statute or is there, what directs us to do these services? Is it just the will of the people, the will of the commissioner, or is there something outside of us that compels us to do this?
So when a county takes on extension, it's in statute that there will be a minimally efficient extension program, I believe is the state statute wording. But basically, once you have an extension program, the key is that you have to do programming in 4 programmatic areas. Those 4 programmatic areas are in community vitality, community development, ag and natural resources, family and consumer sciences, and then youth development.
What's the last one?
Youth development, 4-H youth development.
Is this always has a connection to K-State University or is this?
Yes, so extension is a cooperative system. So there's federal funds that come into the system, there's state funds that come into the system. And then there's your local appropriations plus any grants. And so it's cooperative both financially and also programmatically. So there's a group of advisors underneath the board that comes together and says, these are the local issues that we think need to be addressed. And through our agent network and our specialists, we start talking about how to deliver those programs. So it's a cooperative system, both programmatically and also financially.
I just went through a lot of the paperwork in your packet here and one of the sheets talks about the big 8.
The big 8, those are 8 issues that came from a major needs analysis across the state. And those are the 8 issues that we really want to emphasize in the next couple of years.
I'm just trying to understand how K-State Extension would have a connection to solutions for these specific things. And K-State Extension, in my opinion, has always been about education. It's always been about, community opportunities, connection network, that type of thing. But things like housing, I don't know how in the world K-State Extension can possibly lead, if you will, in a solution to our, or maybe affordable housing challenges of our state. So I'd love to know more about why are these on the sheet of paper here? What are you exactly doing?
So with directly relating to housing, some of the things that we're doing is we have the College of Architecture, Planning and Design. And they have been out working with communities on appropriate housing in communities. And so it's a huge problem. And, and there's a lot more issues to address than just that. But we are going to put more resources to that and try to help communities to solve their problems. But housing is an issue. In Wichita, in Sedgwick County, it's also an issue in some of our rural counties, and it is just something that we want to move forward on. And we're not being prescriptive with it. We want to work with communities to help them decide what path they want to pursue. and support that path.
I probably, I know I have a tour with you on Friday, Dr. Brantley, but I just wanted to say that these 8 things, I'm curious exactly why are they on this page and what's the relationship to extension specifically? Some of these are very difficult, really large topics. And maybe I don't understand exactly why they're on the sheet here, but we don't have to talk about them right now. I just wanted to say I would like to know more about that.
And Commissioner, you make a good point. I don't have a hammer in my office. I'm not gonna start building houses or anything like that. But I think the main thing and what Dr. Hadley has said is just connecting people to the resources on campus that our president at K-State has kind of empowered and engaged all the departments to go out through the state of Kansas. That's the K-State 105 way. So all 105 counties that, hopefully they don't just sit in the ivory tower, and that we're supposed to go out throughout the state and share the resources, share what the university has to offer. And so I think it's connecting resources, but then also the education component too.
Chairman, I have one final question, if that's okay.
Sure, of course.
So there was a lot of debate last several months, maybe last 4 or 5 months regarding SHIC funding. Can you please? I think you already mentioned a little bit about it a minute ago, but I want to be really crisp and clear. Where does the funding for SHIC counselors come from, and is that at risk, or why are we being hammered from people who apparently think that we are shutting down SHIC counseling?
What happened was when we received the 10% budget cut, that's $80,000, a little over $80,000. And we had an employee leave at that same time. And she is an agent who oversees the adult development programming and the SHIC program. So she is one of the K-State employees, paid through county money and K-State reimbursement as well. And when we were receiving the cut, and when there was discussion that then there might be more in the future too, we're thinking maybe we can't fulfill this position. Maybe we need to leave it open. Maybe we can't hire someone because this is basically a full amount, someone's salary. We do receive money from KDADS for the SHIC program, but that helps to pay for the 2 part-time coordinators, specifically in the SHIC program, and mileage reimbursement for the volunteers and supplies as far as that goes. But the person who oversees the SHIC program and does our adult development programming is paid with county money.
Other questions? Commissioner Meister?
Thank you, Mr. Chairman. Thanks for the presentation, and this is very helpful information. So I see on your budget sheet here, so your budget is about $1.5 million, and the county appropriations is $742,000 of that, about half or so. So my question is, and you've referenced KDADS and K-State a lot. Are you doing this same presentation to other groups that help fund you? Or are you just coming to Sedgwick County, who already is doing about half your funding?
Sedgwick County is one of our primary funders.
Right.
K-State, they know our situation for sure. And the rest of the money comes from sales, room rentals, programming where we charge registration at times, and donations.
Okay, so I guess that answer is you're not going back to K-State or to KDADS to ask for additional funding on certain areas?
I have talked to KDADS, especially with regards to the SHIC position, and shared with them that it's, we don't know if we can hold this position and whatnot. And the problem with KDADS funding is they give us a bottom line figure, and then all of a sudden they might have more and they'll say, oh, here's an extra $20,000. Not a bad thing, but you can't plan on that. But so KDADS knows our situation, and certainly Greg's sitting here and they know our situation too. The allocation from K-State is a very structured reimbursement.
Okay, so I guess in our budget process, although SHIC is funded by various grants and whatever, we could consider just itemizing line. We could say we want to, whatever you're saying is your 80,000 is this position at SHIC that keeps that, because it's a great program. They statewide, and it's one of
We're
the,
keeping it.
I've
We've
told
figured out
you,
ways to.
and I've mentioned before that we don't get a lot of kudos in all the 45 departments we have, but we do get kudos about your staff and the SHIC support. So I'd almost consider, well, let's make sure SHIC's running, and I'm sorry about all the other stuff. Look for, because your brochure here and everything, everything says K-State pretty much, colors, everything. And I just want to make sure, I mean, Sedgwick County is half your funding, but Sedgwick County is not prominently displayed in all. I'm not asking that we need to be. I'm just saying, I feel like we're doing our share, and I'm okay with keeping SHIC going, but I'd sure like to know that everybody else is also aware that of your needs and your shortcomings, and so it's a little bit awkward, but we are half. We don't look like we're half, but we are half. And so that's just an observation. And but I do believe in the SHIC program. I was unaware that we are directly involved in SHIC. I thought that was separately funded through grants and KDABs and other departments. So I guess besides everything else, we are part of SHIC as well. That's what you're saying. Thank you.
A couple questions. This might be Lindsay or maybe even Justin. Is this just, do we just block grant money over? Is that what this is? We're looking at 30 some years of history. It's just a block grant. There's no direction of how the funds are used. It's just.
Correct.
Okay. And I did have questions on all the revenue sources. Greg, the K-State one, is that just like that's a fixed number? Is that what that is? And is that across the entire state to all extension centers that way? Or is there a formula of sorts, or?
Yeah, there is a formula of sorts, and everybody gets that fixed amount for agents. It goes like about 21,000, I believe, for the first 2 agents, and then it drops down to about 18,000 for the additional agents up to their cap number of agents, and then after that, there is, if Sedgwick County Extension wanted to hire additional agents up and above that, then it would be in at the state minimum, which would be about $1,500.
Okay.
Under state statute, the way the funds work, and granted, this is 1950s numbers, that $1,500 is the minimum expectation of K-State to go into salaries. That probably was about 30% of the agent salaries back then. And roughly across the state, we're at about 33% of agent salary and benefits for the average agent salary.
Okay, that's helpful. Thank you. I want to talk, Dr. Brantley, a little bit about the SHIC program, because when we talk about the block grant, you guys do a significant number of the SHIC program, and you might just give for the public just a real brief overview of what SHIC is. But my specific question is, what all are you doing comparative to what else is happening throughout the county? I mean, we have other departments that do SHIC. What is the volume that you're doing comparative? I mean, if we're going to block grant money over and try to make sure it's securing some positions, I guess my view is that I want to make sure there's not too much terrible redundancy. And I want to know proportionally what load you're bearing for the community SHIC application. So anybody that can help me answer that, I think would be.
Oh, you betcha. Yeah, SHIC is important. It's Medicare counseling. It can be done throughout the year for people who turn 65 or close to turning 65. But our busy time of the year is open enrollment. We start taking phone calls in August to schedule people to come in between October and December. And usually we fill up before August, the end of August for the October through December. Our SHIC volunteers are long-term volunteers. They've been there forever. And so, not forever, but a lot of them are long-term. And then we have a few new people as well. But what's important is their experience in understanding this, you might want to consider this, look at this, but it's unbiased. And, they just kind of show the choices and then people can leave. The people appreciate the ease and the accessibility of extension. I think that they've come to trust extension SHIC programming and Medicare counseling through extension in Sedgwick County. And Sedgwick County has kind of become the go-to for KDADs. We have overseen their statewide hotline. And so when people call their hotline, it comes to our office.
So can I pause real quick? 2 questions on that. So through KDADs is appropriate or has distinguished the extension center as the SHIC hotline, and you're fielding all those calls.
Yes.
Your staff is. So how many SHIC applications and consultations are you doing? And on the side of that, who else is doing that for us in Sedgwick County government? And by comparison, is the extension center doing the bulk of that work or?
Yes, the Department on Aging also receives a very small grant from KDADS to fund a small portion. I think it's less than $5,000. Department on Aging has staff that do some SHIC counseling. And then we also encourage the senior centers, the more advanced ones, to train people and make that offer available through their setting as well. And I think in comparison, there's a lot of private sector insurance companies that do SHIC counseling, and that's going to be where you see the highest volume of advertising and that sort of thing. When you get to be my age, you get invited to dinner all the time for that sort of thing. So
I guess my thought is if we got money coming, if Sedgwick County is appropriating dollars towards SHIC counseling, the pipe department is the biggest bang for the buck through extension or not? And should we be considering that as we think about the block grant that we give?
One of our partners, we work with CPAAA. And I know that they have kind of been in and out of directors, I believe. I'm not totally sure about their situation, but so, we, of course, I guess we have not a leader either at this time, but usually if we're full, then we send them to CPAAA.
Okay.
Yeah. But, I was looking in the impact report as far as counseling appointments, total people seen over 2,000 people, 3,000 phone calls answered, 2,509 hotline calls. We do Medicare options classes. Like Mr. Kaufman had mentioned, there are people who are in private industry and they try to give them biased information and encourage people to use their product, but we give them unbiased information. But with that, it looks like we have saved, I think in 2024, the citizens of Sedgwick County over $2 million, $2,323,034.
Got it. Well, I guess in my view, and I appreciate this presentation, we've had several conversations about this, but in my view, I do think that SHIC counseling is probably a core service of what an aging department should be doing for those in this season of their lives. But it sounds as if Extension's doing the bulk of that work and not our aging department. Is that a fair discussion? And how can we either support that work or partner better or?
The seasonal nature of the work also benefits us in partnering with others like the Extension Center. We've got staff that are delivering all types of different services, aging related services, information and referral. And then during that season, that November, December area, the county staff will focus their efforts on SHIC, but the rest of the year they're doing other stuff as well. So it kind of makes sense to partner with other organizations like Extension, and then encourage places like senior centers to go ahead and ramp up during that period of time as well.
Okay, this is helpful. So during our budget retreat and discussions, can we talk about what that partnership really looks like with senior centers? I know we're in transition right now with our aging director, but I think that this is a conversation worth having, making sure that SHIC is actually funded well and appropriately, whether it's us doing it or them doing it or in partnership, making sure it's working effectively. So
I might add that when the senior centers, usually they are sent to us and we do the training, submit the information to KDADS and they do the shadowing with us. And then they go out to the senior centers and do their work. Not only in Sedgwick County, but Harvey and Butler County as
Okay,
well.
great.
And one of the advantages is we want as many different access points out there in the community for seniors so that they can go where they're comfortable.
Agreed. Yeah. Agreed. Okay. Other questions, Commissioner Blumer?
And I may have missed it there whenever you're going through the talking points, so maybe kind of bring me up to speed, but looking for collaboration opportunities, are we doing much in the schools? Are we doing much with career pathways? I just always think of extension and education and, maybe you're already doing this stuff, looking at internships, card deals, stuff like that. Can you kind of give me a little taste of some of that if we're doing any of that?
You bet. Our 4-H youth development programming, we have the school enrichment component and we go into schools and do, the age-old extension programs, making bread, oh, look, wheat into bread, or the butterfly larva turns into a butterfly. But even recently, especially after COVID, we do more social-emotional type of stuff called Mindful Me. And so we have a couple of staff members who go into the schools and do that type of programming. And we also have our master gardeners go into schools as well and talk about anything, plants and horticulture too. And so that's how we get started. One of the really neat things is because we're a part of K-State, K-State, the admissions representative from K-State came and provided a non-biased, I think it was FAFSA and how to fill out the FAFSA and all of that type of stuff for Hispanic students. We have a Spanish speaking employee in our office. And so we were able to partner up with them and go into some schools and try to help them with that as well. So we're always looking for opportunities though. Yeah.
Great question. Okay. Anything else? Dr. Brantley, thank you. Very helpful. Appreciate it, Greg. Jan, thanks for coming.
Thank you.
Appreciate it. Paul?
Jennifer? Yep.
Thank you, guys. Yeah, good to see you.
Hi,
Thanks for being here.
thanks for having me. Good morning. My name is Jennifer Wilson, and I am the Director of Crisis Services at Sedgwick County's ComCare. Joan Tammany, she's under the weather. She's going to join me and hopefully be available to help answer questions. Hopefully I can fulfill that need. So, but if not, I can bring you back information. So first, I'm going to go over some of the history of ComCare, our service continuum, and what led us to this discussion of program expansion. And then Andrew's going to go over some of the construction and facility information. And then we have Doug from Helix who will go over some of the concept and design. All right. Okay, so really, early crisis services in Sedgwick County began with an after-hour on-call, which eventually evolved to a 24/7 crisis facility in 1990. The first 24/7 facility was opened in 1993, and really the focus was on screening and assessment. So people who needed some acute stabilization or state hospitalization would go to our center, be screened and assessed for risk of self-care failure or harm to self and others, and then be referred to the appropriate level of care. Crisis services moved to Northwater. I know I remember that much smaller operation than we have now in 1998, where we were a 24/7 walk-in crisis intervention center. So law enforcement officers could bring individuals who are experiencing a mental health related crisis into the Northwater location, and we could provide walk-in care on a 24/7 basis. Then the crisis intervention team model launched in 2007, which influenced the vision of this one-stop shop, which is where individuals can access an assessment for service, receive stabilization care, and hopefully get referred to outpatient services all in that one building, as well as sobering and detox services. So in 2015, we were able to open that one-stop community crisis center where we provided crisis intervention services to individuals in mental health crisis. And we partnered with SAC, who is also located at our crisis center, to provide those sobering and detox services, in which they also do assessments and can refer to the necessary treatment for substance use disorder services post-detox. And then we also have our crisis stabilization at the other building at 1720 East Morris, because we just don't have room to be able to provide that service continuum in that one building at 635 North Main. Joan Tammany, she put together this lovely timeline that kind of illustrates the growth of our crisis continuum over time. So in the 1980s, there was the initiated after-hour on-call services. And then in 1990, being able to have that 24/7 manned center, 93 24/7 crisis facilities, and also the first mobile crisis response. We were able to respond to individuals in the community experiencing a mental health related crisis. It looks a little different than our current mobile model, but we were able to provide some mobile intervention at that time as well. 2014, some crisis stabilization unit beds, which are now provided at the Morris address, and the suicide prevention lifeline, now known as 988. We started answering those calls coming in that national lifeline for individuals in our area. Community Crisis Center was opened in 2015, now 635 North Main. And I'll go over the continuum of care in a couple of slides. And then in 2020, this is where you really see this rapid growth, where we had that partnership with the Wichita Police Department. We have that one ICT co-responder team established. And then 2022, we launched 988, which the goal was to answer 90% of calls coming from Kansas in Kansas. And we have been able to meet that since that line launched. And then in 2023, we expanded our ICT teams from 1 team to 5. So we have that one co-responder team, and then we have 4 additional teams that have a clinician and an integrated care specialist to help respond to mental health related calls. We might not have a police officer assigned to each one of those teams, but if somebody goes out, calls 911, needs some help, a police officer responds, they're like, oh, there's a mental health component on this call. They can call one of those teams to join them and help that intervention with the goal to treat them in place. And then we also embedded 2 integrated care specialists in our 911 center. So we have ComCare integrated care specialists that are kind of a branch of our 988 team in the 911 emergency services call center, able to take calls when there's a mental health component there. This is a continuum of crisis services that we offer at the 635 North Main location in Morris Place. So we have our 988 line, which I touched on just a little bit ago, 24/7 walk-in crisis intervention services, which is anyone. So someone identifies that they have something that they need to some help with, they'll go in themselves. They don't require a referral. They can refer themselves. A law enforcement officer locates someone that they feel needs a mental health intervention. They can bring them to our door. A family member, loved one, they can call 988 and the 988 can refer them to our center. So there's a lot of ways in which somebody can get connected to come to our center and receive those services. We have a 23-hour adult crisis stabilization unit in the 635 location. So somebody can receive stabilization services up to 23 hours. If they need any longer stabilization, they can be assessed and referred to our Morris Place location, so they can get up to, they can really, it's on average 72 hours, but if they're assessed and needing longer, they can stay longer for that care. We have a partnership with the Wichita Children's Home, which gives 1 youth stabilization bed. And then we have 8 full-time mobile crisis intervention teams. So we have 8 teams that comprise of 1 integrated care specialist and 1 master's level clinician for each team to allow us to provide 24/7 mobile crisis intervention services with the goal of responding to crisis within an hour of the request. And we are able to do it in less than an hour. I think we're averaging about 38 minutes right now. We have sobering detox services. Again, like I said, we partner with the Substance Abuse Center of Kansas to provide sobering beds. And then from there, they can refer them to one of their detox beds, and they can have detox services up to 5 days. And then they do get an assessment, do get referred to care post detox. We do have a good partnership with NAMI. We refer NAMI all of the time. They have been a big part in establishing that one-stop shop. They share their materials often, and we share it to those coming to seek our services so they can get connected once they go home and they need ongoing support. We have 1 social worker and then an inpatient team that serves our calm care patients admitted to Via Christi Behavioral Health. We have some community-based case management services that we provide to some of the high utilizers or folks that don't qualify for typical case management, but may need a couple of tasks in order to resolve their crisis so they can get some ongoing care post-crisis. Some of the justice diversion services are mental health court, the offender assessment program are manned in our Morris Place building. And then we have an assisted outpatient treatment team for people who are needing some additional supports when discharging from Osawatomie State Hospital. They can be referred to that kind of order to help with treatment adherence post-treatment. And then we do competency evaluation. Recently began restoration services for those sitting in Sedgwick County Jail waiting for restoration. And if they're appropriate to receive restoration services while they're still in jail, they can get that service from us if the person completing the evaluation finds it appropriate. And then, like I said, our integrated care teams and 911 embedded integrated care specialists. Lots going on. I think I added everything below NAMI happening in the last few years. It's pretty amazing how crisis services have grown. Wichita State's Public Policy and Management Center completed some cost avoidance study to understand the impact that the Community Crisis Center has for our community. And they take into consideration the cost savings from hospitalizations, emergency medical service like EMS transportation and services that they provide, the Wichita Police Department costs and Sedgwick County jail costs. So in 2015, they estimated a cost savings of $8.1 million. And then jumping to 2018, it almost doubled to $15.5 million. We're in process of working with KU School of Medicine to complete another cost avoidance study, and I'm really eager to see what that brings. So yeah. Yeah, I would love to see what it looks like now. So really now what rapid expansion has led to really limited space. So we really are trying to figure out how to provide this level of service in the space that we have. And it's been difficult, but we're getting it done. But really that expanded space is really needed. Plan to combine Morris and Main Street locations. So we're operating out of 1 building is the goal. We plan to expand the crisis observation, stabilization, and detox services to meet the community demand and also to provide access to care to those who need it. We provide, and we do move to provide evaluation and stabilization services as a crisis intervention center. Right now, we're operating at the Morris Place as a crisis residential center. So that's how we're licensed. And we're really trying to move towards what the state is working on, and that is crisis intervention centers, which is a higher level of care as an alternative to the state hospital. So people who need that involuntary care or maybe longer stabilization services could be referred to our center as the crisis intervention center to receive that level of care rather than waiting days until a bed is available at Osawatomie State Hospital or having to travel hours to get that treatment. They can receive it
Just
locally.
quick question, because I know questions come in. Is that for adults only, no children?
Adults only, yes.
Okay.
So what does expansion look like? We plan to increase our observation recliners is what we call them. And they're not beds because it's not a residential center. It's that 23 hours, 6 recliners to 8 recliners. We'll increase stabilization beds from 6 beds to 7 beds. And then crisis intervention center is really a center within the build. It's required to have its own facilities, its own entry point. So the whole idea is to have it on, what did we say, the southeast corner of the building, to have its own entryway, have its own reception, visiting units, facilities, and separated really from all the other operations within the building. The plan is to have 6 stabilization beds, include its own intake and assessment, and have all the other program components. That's where I'm saying like the office space, visiting space, activity room, everything. This is really going to help free the emergency departments from holding mental health patients in their emergency room, waiting for a bed, or just being able to provide services locally to help improve access to care. And I mean, right now they're having to drive 2.5 hours to Osawatomie to get care and be separated from loved ones.
I'm sorry to pause again, but I think we need to pause on this point. Is this the biggest differentiator, this factor bullet number 3, compared to what we have now to what is coming with the new ComCare Crisis Center?
Absolutely. We do not
Okay.
provide this level of care in any of our current services. We do not operate as a crisis intervention center. But that's the way that the state's moving. So we really have to do it.
Right. So is this funding coming from county or CCBHC dollars that are like grant funded for? Is there a special pot of money for this from the state now? Is this, I'm very much in favor of this, and I know it's a need. My point is this, I want the public to know that this is the big difference between what we have now and what's coming, is this bullet right here.
There are some state dollars that are planned to be able to fund some of the services provided as a crisis intervention center. The specific amount, I don't know, and I wish Joni was here to be able to that. And the sobering and detox, that's going to be a huge component too. So the plan is to increase sobering beds from 8 to 10 and detox beds from 15 to 26, allowing people to receive those social detox services more frequently, or have improving the access, I guess. And then we're really working on bridging funding sources for medical detox services. Currently, that's not a service offered from our community crisis center, but the goal is to really have that. So working with multiple agencies to see who has an interest and can be able to provide that service.
Yeah, again, I'm so sorry, but I'm really sorry, but the medical detox piece of this is a big
Huge.
part of this. So
It's huge.
are you saying right now we don't have that?
Not at the community crisis center. We have to refer out, and there's only a couple of centers locally, and you have to have insurance.
Yeah, no one does it if you don't have insurance. My specific question was, is this a plan that will be in the new ComCare Crisis Center? We're just trying to find out the funding source. Like, are we committed to the medical detox piece of this?
Yes, we are. SAC is very committed to that. They'll be the ones that manage the medical detox, but we're working with them and KDADs to identify
But
funding.
this is we're committed to this, right? Okay.
Absolutely. And then again, just ending, because we're expanding the continuum of care, we really are going to have to need to align staffing with those expanded services. And then lastly, I wanted to touch on the possible partnership with the Biomed Center, because we do share a campus with them. We're on the same corner, and we're sharing the same area. So we're going to be built right next door, and the close proximity allows for new opportunities for us as the Community Crisis Center and for their experiential learning. We hope to have possible medical technician or mental health technicians is what that should have said, nursing, clinicians, physicians, assistants, and other med student opportunities early on in those discussions. So we don't really know what the plans are definitively, but we do hope to open up some opportunities. And then that will also increase the student placement, or the student placements will increase our opportunities to hopefully recruit people to work for us in the future. That's the ultimate goal. So we want to have ComCare as their new employer. I think here I'm going to turn it over to Andrew.
Good morning, Chairman and Commissioners. Andrew Diltz, your Facilities Director. I'll cover a few items here on this slide and then we'll pass it off here to Helix. So in 2024, we purchased a land and building, as Jennifer referred to. It is on the same city block as the Wichita Biomed Center. Our design will complement the building as much as we can. So there's going to be some uniformity between the Biomed Center and our building as well. Our current timeline, we're anticipating construction documents to be ready late February, early March, and we'll have the project out to bid mid to late March following that. Our current budget right now, we have approved CIP for just over 15 million. We do anticipate that to increase. Right now, our current estimates are coming in around 22, 23 million. And once we put it out to bid and know what our final costs, construction costs are going to be, we'll submit a CIP amendment for that. And then our estimated project completion is the summer and fall of 2026, which should align very closely to the Biomed campus, if not be slightly before. And then I'll pass it off. We have Helix here with us in the room. We have Jessica Irons on Zoom, and I'm not sure if Clay's here, but we're also working with Clay. And Helix is doing the design for the Biomed Center. They've been great to work with. And here's Doug. He's going to walk you through the building.
Hey, Doug, welcome.
Good morning, everybody. We got to switch to PowerPoint slide deck real quick. Andrew gave me a heads up, Andrew and Tanya, there's a few new board commissioners, correct? So I'm going to give a very, very brief recap of kind of where we began and how we got to where we are.
1 second, Doug. Sure.
Sorry, just trying to get up to speed here. On that last slide, I understand, the state's paying for a lot. We pay for a portion of it. What portion are we paying of the $15 million for the new construction of the building?
Lindsay might be able to handle that one.
So the project is proposed to be bond funded, which would mean at least the debt payments themselves would be scheduled to be repaid from a property tax fund. One of the things we are hoping to do once we understand the difference in how the building is structured for SAC versus county functions is whether or not we can look to repay some of that with some of the CCBHC funding that we receive through the state. But right now that has not been anticipated in the costing reports that have been sent out, because we know that it will be a while before this is open. So at least initially it will be to those property tax funds. One thing I do want to mention, because Andrew lobbed his bomb of $15 million, which was what was included in the original budget. But probably the cost estimate is closer to actual 22 million, is if you'll recall when we talked about those year-end transfers and we said that we expected ComCare crisis and we expected the administration building to be greater than what was authorized originally under the project authorization, and we moved that cash into the CIP fund, we would anticipate to cover that gap with that cash. So I don't want to have any heart attacks from the bench. We've got a game plan to buy down how much debt we actually have to issue for the project. So does that answer your question?
So I have a better understanding of what you're forecasting, what we think we might be able to.
So right now we don't have a good forecast for that. Unfortunately, I think we need to understand what services will be in there that can be billed for to the state. And then also recognizing that SAC is an individual provider that will be housed with ComCare. We obviously would not be able to pay for that portion with those revenues, because those are revenues coming to the county for service. Those wouldn't be eligible to be funded with bonds anyway. So we'll need to do some of that analysis. I would guess if we were super optimistic, maybe 50% of the debt costs could be paid for, but I wouldn't anticipate any more than that. And certainly we need to have that conversation about those costing reports and those estimates down the road.
Okay. Thank you.
Sure.
Could we do just a real quick financial summary, Andrew, maybe from you? The year this was, and the reason costs have
2019.
gone up is it's 2017, 2018, when we originally approved the project and then amended a CIP. And could you just go over very quickly the succession of funding for this?
Do you remember when the original CIP was?
So it was approved as a part of the 2020 budget. So that means estimates were the last updated in early 2019. And also at the time, you'll recall that we had a much lower portion. Well, not all of you will recall, but rest assured, we had, I think it was $1.7 million in the original budget for land. And then we actually spent more than $4 million to acquire the land in order to co-locate this with the biomed facility. So we already knew at that time that this project would cost more. And then, yes, if you've been at the Economic Outlook Conference this most recent year, they talked about the PPI, which is basically the cost of it's inflation for buildings. It has gone up astronomically. So that is how we got from a 2019 plan. Now we're talking 2025 dollars. It's just a whole different ballgame, unfortunately.
And I will add, we updated the 15. We updated, I think it was in 2021, 2022. But we hadn't really seen the significance of the building inflation costs yet at that time. So we're seeing that now.
Sounds pretty reflective of what we went through with the multimodal centers where 2019, we forecast the numbers and really different conversation.
Exactly. I think that's the case for everybody, unfortunately.
Just to do some clarification here. So when you said 4 million for land and you said 22 to 23 million, does that include the 4 million for land or is that?
Yeah, so my 23 million is project total. It's all inclusive of the entire project from A to Z, what we're going to have in the land and the building after construction is complete, and we're turning it over to ComCare to open the doors.
Okay, a couple, I guess, two more follow-up questions. You mentioned about half of it paid for by
Optimistically.
optimistically, and you say half of what number? 23 or half
So
of 15?
half of 15, because remember, we've got that extra cash that we were able to put into the CIP fund. So we would pay the gap between what has been authorized. Because remember, one of our steps is a project authorization. That's where you all say how much bond funding you will allow down the road. At the time that you adopted the CIP, we also did a project authorization that limited that amount to just a little under 16 million. So we would issue debt for no more than that. Anything between that 16 million and the 22 million or whatever that total price tag is, we would just pay as cash.
Okay, so when you say half paid for, what you mean by that is the amount over 15 or that number that we.
I mean, the debt service that we would pay on that over 20 years. We do not want to just go in and take $3.5 million from the ComCare grant fund and pay that down. We've got the general fund cash for that portion. Then there would be the roughly $15 million of debt service that we would structure to repay over 20 years. Of that, I'm optimistic that up to half could be paid for with CCBHC revenues, assuming we are able to build it into a future costing report and the state says it's okay and gives us those funds. So I can't, that's why I'm saying optimistically, because I can't promise anything right now.
And just, I guess, $23 million. We're not building the building, we're remodeling the building.
Correct. So there is a remodel. There's also an expansion to the north, which Doug will cover. And one clarification I want to make is I believe we bought the land and building for 5.4 million.
Oh, sorry.
So it was slightly higher, but yes.
Thanks for the reminder. What's going to happen to the buildings we're vacating?
So the future of the buildings that we're vacating, there right now we have a lease that we're planning to terminate.
Morris?
Yes, that's on Morris for scope. And then we have the building that ComCare Crisis and SAC currently operate out of. The future for that has not been determined at this point, but we have some ideas, and depending on how things come out, we might be able to sell them or dispose of them some other way.
My final question would be this, and I'm sure the architects are doing a great job, engineers are doing a great job. I'm sure it's going to meet all of our needs for a long, long time. Is there anybody, I guess, looking at that plan in light of the taxpayer saying, we're going to try to get as much cost out of this. We want an effective building. But in terms of the taxpayers' interest in this, I want to be frugal. I don't want to spend money for things that are basically maybe more than we need. So how do we know we're not being a little bit more, the numbers are maybe a little bit larger than maybe they could be if we were a little bit more frugal? How do we know that?
I don't think that we are spending money on things that are not appropriate. The things that we are doing that are a little bit unique to this build are geared more towards behavioral health and recovery. That has been the focus from the very beginning of this project. And as Doug gets into his PowerPoint here, he'll cover some of the goals that we set out. And
I guess a final comment. So it wasn't that long ago, in 2015, we did the one-stop shop. We celebrated, this community celebrated. We did a CIP, I believe, to do significant improvements to that building. And that wasn't that long ago. So just it's actually has some unique features to the building now because we added some really important resources to the building so it could do what it needs to do. So I guess I'd like to be reminded, what do we spend on that previous CIP project to get that building to the one-stop shop in 2015? What was the cost?
It was about 2 million.
$2 million. All right, thank you.
Well, and Tim, I think you guys have other plans for use of that facility, don't you?
Number of different ideas. Nothing's been solidified yet. And Commissioner Howell, I think the comment that I would make about we did that work in 2015 and then you saw the success and the increase. The reason that the cost savings are greater was because service volume increased pretty dramatically over that period of time. And the need, especially after the pandemic, we've seen a pretty big spike in the need for crisis services. And so this is kind of a response to, we built it, they came and a lot came. And so we know that we need to expand to meet the needs of the community.
All right, Doug.
Okay, I just want to make sure my colleague Jessica can hear and speak. Jessica, are you there?
I can hear you guys. Can you hear me?
Okay, great. We're going to go a little bit of back and forth. Jessica is our lead interior designer and I'm sort of the lead architect. So we work hand in hand throughout the process. So I'm going to let Jessica kind of lead off with sort of our project statement. Is this working? All right, Jessica, it's all yours.
Yeah, so we've been working with ComCare and SAC and everyone within the departments for quite some time now and touring their existing facilities and just building their future program and working extensively to create some overarching project goals. So I'll talk about those quickly. The overall goal for the project is being located next to the biomedical campus and bringing all of their different departments into one building. So consolidating and having everyone within one cohesive location will just provide the best services for the surrounding areas. And we are wanting to develop an environment that's not only welcoming and comfortable for patients, but just has a very positive experience while they're there and provides the infrastructure that the staff needs to provide the level of care that the patients need in the space. And also, in addition to that, providing the type of workplace that the staff really needs. They have a really tough job, so creating a space that they can have some quiet time and also just some space where it's going to be designed in a way that gives them conferencing offices, open office, a nice break room. So a nice space that they can have that's just for the staff as well, so that they can give the patients what they need. And so as we dove into the design concept for the project, these are the three overarching just design narrative goals that we keep coming back to as we've designed the building. So we want to provide a path to healing for all of the patients that are within the building. In doing that, we think making sure that the design and interiors has a connection to nature. So bringing in natural finishes and a nice color palette that just feels soothing and inviting to patients when they're there. And in doing that, we think creating spaces that feel lived in and that aren't too cold or sterile like some healthcare places can feel. We want these spaces to feel inviting and like a good place where the patients can heal and recover.
Okay, so I wanted to provide everyone with a little bit of context, as Andrew mentioned, and several others, that we are co-located with the Wichita Biomedical Center here, which you see in this fairly large upside down L shape building, which obviously north to the top of the page and south. And so we have English on the south, Broadway on the west, Topeka on the east, and Williams on the north. And it is designed as sort of a shared experience, that being sort of a lot of the streetscape and sidewalk replacements so that it can be a cohesive block when it's all said and done. And the intent is to have a few shared spaces with the Wichita Biomedical Center. You see this portion here on the lower left-hand side, which is the loading dock for the Wichita Biomedical Center. It will also be an access point, and I should say a secured access point for the Community Crisis Center, in which law enforcement can bring patients to the specific area and allow them for a separate entry. We also have a pretty big space in between the two buildings here at the center, and I'll get into that here in a few minutes. So I'll start with the existing building as it sits today. It has currently a total square footage of about 32,400 gross square feet. The program, when we were from the onset of this project, we were given a program of 45,000 square feet. So one of the tasks that we had to figure out as a first move, a first step, was how are we going to address the disparity of square footages desired from the square footages that are available. And so this, what you see here, is a first level containing about 16,800 square feet. I should mention that this place used to be was it battery or automobile warehouse, in which vehicles could literally drive into the building and also drive to the second floor. There is currently a giant void in the second floor, which used to be where the ramp to allow the vehicles to get up to the second floor. So it's a very sturdy, very stable building, which has obviously allowed it to continue to be where it is today, and that it's repairable. That said, with the removal of the ramp here, that did destabilize this big, thick braced masonry wall that faces to the north. We saw that as an opportunity, not necessarily a problem. And so as we began to figure out how we were going to address the program, we explored a couple different ways very early on that potentially maybe there would be some form of an addition to the north, because that's where we had the space, which would help get us to the square footages that we initially thought were needed for the program. We also explored some very early ideas about adding a second level to the building, because the building had a stout enough structure that it could handle some level of addition going upwards. So this basically told us we could do one of two things. We could add on to the building laterally, or we could go up a little bit. And as we sort of worked through all the different programmatic needs, we were actually able to reconfigure the program such that we ended up not needing the full 45,000 square feet. So as being not just good designers, but I feel good stewards of the taxpayer dollars, we basically took a big program and we kind of pushed it into a smaller space. A lot of that has to do with the consolidation of all these programs coming under one roof, as opposed to being in separate locations. You can combine a whole variety of things that are needed for all of those services to exist. And so the other piece of economy that we thought was pretty helpful was, given the timing of this project, we could see some benefit at bid, potentially, if the two contractors that are working on the Wichita Biomedical Center do submit bids, and if they're competitive, they have a giant crane here that basically covers the entire block. So we could also see some efficiencies picked up there and provide some economy. So now I'm going to hand it back over to Jessica to help walk us through the design of the space for both levels of the building. Jessica?
Yeah, could we actually scroll down? I think levels 1 and 2 got flipped.
I did get up. They're backwards.
Yep. So I'll walk through the plans quickly so we kind of can understand where program is located in the building. So starting at the top, the north end of the building, we have studied an extension onto the north end. So that bump out there, it will house a new vestibule and lobby into the building itself. So right now that's just a solid brick wall. So we wanted to make the space feel inviting as possible, and natural daylight is a great way to do that. So that lobby will be directly adjacent to the parking lot for the building itself. So you can come in that main entrance door into a secure vestibule that will have a window into reception and security. So security will have a camera and they can allow people into the building from there. And then they'll be accompanied by a staff member. So we've worked through the best flow into this type of facility closely and feel that we have a good approach just getting into the facility itself. And then once you're in the lobby, there's a stair and an elevator that can lead you to level 2 that also has a secure area for patient care as well. And then off of the main lobby, you can go to the lobby for SAC. So the two are connected, and the SAC lobby also has its own exterior door for law enforcement if they have a person that they need to drop off directly into SAC and don't want to pull to the main entrance of the building. That was a key component that we thought made sense off of that secure alleyway. And so from there, the left side of the plan focuses on the program for SAC. And then the right side of the program, connected with a central corridor, focuses on crisis observation, stabilization, and the new program for CIC is in the bottom right corner. And in the southeast corner of the building, that is where CIC will have its own secure entry into that portion of the building as well. So it has a secure vestibule, its own waiting room, its own reception, where it can have security as needed. And so within each of these programs, there are state requirements for the size of the patient rooms, the quantity of rooms and restrooms and showers. So we have laid everything out very carefully to ensure that we are meeting all of those requirements and providing not only the staff, but also the patients with the type of spaces that they need. Another thing I'll note, the rooms that are along the east side of the building, which will have access to natural daylight, are the offices that support those adjacent programs. And off of the central corridor of level 1, we have laundry services, a kitchenette that can serve as distribution for food for all of the programs on the floor, staff restrooms, and MEP related spaces as well. And then at the end of that corridor will be a secure door that can be for deliveries and just egress, exit out of the building. Okay, so up to level 2, we have the stair and the elevator that lead you to level 2, and you land this kind of open waiting area on level 2 with a small security booth that will have monitors and footage of the entire building as needed. And then off of that waiting area, patients can go directly into individual meeting rooms. And there's also a larger conference room that can be utilized for staff and patients as needed. And then we have 2 small patient consult rooms. So another additional amenity that will be housed within this new facility is nursing staff that can provide care for patients. So this is something that ComCare doesn't have today. So this will be an added amenity within this new facility. And then you'll see there's 2 different doors that are secure, a secure point that staff can then go into the secure staff area. And so within level 2, we've located all of the staff spaces. So we have open office workstations and offices kind of around the perimeter of the floor. And then in the center of the floor, we've located conferencing, training room, a nice break room, and restrooms. So all of the amenities kind of in the center of the floor to allow natural daylight to flow just through the space all the way through. And with this, we're providing the staff with just the connection and those open office workstations. That's something that they don't have today. So I think this will allow collaboration more easily between everyone on the floor, and then the appropriate amount of offices and workstations to allow for growth in this facility as well. We're also providing a mother's room, wellness room, which is a really nice amenity that will be nice to have in the facility. And then the centralized break room will be nice for gathering and events, and it's connected directly off of a large training room. So the two can be utilized together and can be utilized for training events. And then in the southeast corner of the floor is where we've located the emergency call center. So this will be secure and acoustically private from the rest of the floor for their needs within their space. Any questions or comments on the plan?
Any questions? Yeah, go ahead.
Is it going to have, is there going to be external security cameras and lighting around the outside of the building?
Yes.
Yes.
Okay.
Yeah,
Other
we're
questions?
working closely on all of the security needs for the facility.
And to some degree for biomed too, right? That's the nice thing about having one architect for
Mhm.
both. So I think security will be looked at as a total for this entire campus.
Okay. So one quick slide on just the overall inspiration for the project itself as we dive into the interiors of the different spaces. So taking into account where Wichita is located in the prairies and the Flint Hills of the state. So just drawing inspiration from the surrounding natural scape that the project is located in, bringing in natural colors that just are a soothing palette for staff and patients when they're in the facility.
I'm going to give you a couple views from the exterior and also in the context of the Wichita Biomedical Center. What you're looking at here is a view along Topeka, looking kind of down at the parking lot and the small little park-like space that's really going to be situated in between the two facilities. So this should also add some more, well, relief from the summer sun, if you will. And just a place to sort of allow people to sort of have some time outside and enjoy the outdoors. But there is a parking lot that serves patients only. I believe all staff is going to have to park elsewhere. Is that correct, Andrew? But we're maximizing the land as best we can for both parking and human space. And you'll see here, this is I spoke earlier about trying to find ways to sort of infill existing voids in the building and then add on where needed. So this is essentially the extent of our addition. It's not too big. We feel it's pretty modest, and this total package really gets you a full brand new entry that complements the entry to the clinic on the opposing side of the open space to the biomedical center. It also provides us with the additional flat roof that we need to put all of the mechanical equipment for the facility on top of the lobby space. So we have the new addition serves really the most complex parts of the building. Stairs, elevators, mechanical systems, all of that stuff can be sort of coordinated in the new part, which lessens the complexity with the older part of the building. And we keep the simpler stuff in the older part of the building. I mentioned flat, and that is because the second floor is one gigantic barrel vault, which you'll see here coming up provides for some really interesting spaces, but also complicates our ability to put equipment top of the roof. A little close up of the entry itself, which is a fully glazed facing north, so it'll be a completely comfortable space. All the handicap accessible stalls are right up against the building, a small shelter to get you inside. And then the facility itself, as Jessica spoke earlier, there'll be security immediately behind this initial doorway. It doesn't show the intercom system, but there'll be one here right there on the wall. And then I'll let Jessica kind of walk you through the interior.
Yeah, so this view is once you step into that secure vestibule and the windows into security and reception, that will allow you into the overall space. And then this is standing within the main lobby, looking at that stair that will lead you up to level 2. An overall color approach, trying to take advantage of this addition and the introduction of just a warm color palette and applying that to the architecture and keeping it clean and simple, yet making it feel very warm and inviting. So this is walking further into the space, looking out to the parking lot. We can have a built-in bench seat that will be just to the right for patients as they enter, but also keeping the space very minimal, just understanding the type of patients that will be in this space and bringing in some natural aspects with a planting under the stair, I think adds a nice level of warmth when you're in the lobby. So we have a couple views that would be standing in the living room within the different patient areas. So this is the living room for SAC. So bringing in the green color is just a nice soothing color within the space. And that's the millwork for the nurses station. That's directly looking at the patient living spaces and then the doors leading to the patient rooms. Similarly, this would be the living room of the stabilization area and adjacent offices and the patient rooms. So the goal of these is to really give the staff the infrastructure that they need to support the patients. So lockable millwork, a nurse's station, all directly next to the living area for the patients. And so going up the stairs to level 2, we have it secure with glass, but still providing visibility to that waiting area for patients. And once you're up in this waiting area, you're directly next to those individual meeting rooms that staff can take patients into. And then this is once you're walking into the staff space. So the building itself is really beautiful with existing vaulted ceilings and just taking advantage of the finishes that are there and embracing how beautiful the exposed brick and exposed wood is. So just maintaining that and not complicating it and adding costs. So trying to focus the finishes on the new areas and spaces that we are adding within the building. So this is standing in the center of level 2 within the break room. So providing staff with a variety of seating and millwork that can house the break room equipment and a small vending area for provided lunches whenever staff are there for the day. I think that'll be a nice amenity. That's something new that we're adding to this facility as well. And directly off of the break room is this training room, another amenity that ComCare doesn't have today. So this will be a nice space for staff to gather with just a nice presentation ability that's directly off of that break room. Yeah, we ran through those views pretty quickly, so let us know if there's any
Through any of them if you like.
questions
what-
on
yeah.
anything.
One thing I'll add is on the right-hand side of this shot, back there near the car. So to the right of the glass lobby, there's going to be a generator sitting there. That generator is going to supply backup power for the entire first floor that is housing the majority of the patients. And then the call center on the second floor will also have generator backup. So call center should never go down, will never drop a call.
Yeah, and I noticed, so you're gonna keep that ceiling on the second floor of the roof? Right. Yeah, maybe it's beneficial for our new commissioner, to just walk through and kind of get a vision of what this. It's a
Absolutely.
pretty basic building right now, house cars, but I'm glad that you're keeping that.
Well,
Personally, I think the ceiling.
it's a beautiful space and it's there.
It is,
So
kind of.
there's no need to add anything to it or cover it up. You will notice on the first floor, we did have ACT ceilings throughout. That is for two reasons. One, we have a very complex level of MEP systems that are up in the ceiling. And for the safety of the patients, there's a combination of both ACT where that's permissible, but according to state regulations, we do have to have a lot of hard ceilings so that they can't do harm to themselves by interacting with an ACT ceiling or sprinkler pipes, a whole variety of issues. So there's some of the regulations have really driven, well, they've driven a lot for the first floor, where we have a lot more flexibility on the second floor.
On that picture there, that room on the left would have a ceiling, a ceiling inside it.
The offices
Yes.
or conference room, yes.
And then that's still open above that.
They'd be open above, yeah. I think what I was speaking to is really sort of going back downstairs. You'll see a lot of hard ceilings. You'll see ACT ceilings. So it's going to have a very different look on between the two levels.
It's good. Very functional space. Move on.
Thank you, Commissioner. Again, just trying to get a good understanding. Are there going to be any shared services with the biomed, or is it? I'm trying to understand some of the advantages of being located together.
I think we're looking at it as a shared, like a cooperative learning opportunity. So students that are receiving education from the Biomed Center will have some of their practicum and internship opportunities within our facility.
Question. Commissioner Wise?
Yeah, question on the numbers that we've been given. So if we're estimating closer to 22 to 23 million, does that include furnishing, security? Is that turnkey or is that just construction costs?
So the construction costs are actually a fraction of that
Yeah.
overall cost. So that would be turnkey.
Acquisition. Okay.
Correct. That includes the acquisition of the property. It's the entire project total, and we're handing the keys over to ComCare. with
Every
that
chair,
cost.
every.
Correct.
Okay. And just out of functionality, I guess this is more for Jessica. Do you guys have a lot of lunch times? Do you have a lot of trainings that you currently host, or where are those hosted now?
Oh,
I'm
suggesting
talking
the
about.
architect or
Oh, I'm sorry.
Jennifer,
No, I'm
Jennifer,
sorry,
sorry.
Jennifer.
Sorry, I should have a name
Okay.
tag or something.
Sorry.
We try to do at least annually or quarterly all staff meetings where we can do opportunities for training, staff updates, get people together. And then we also have agency-wide trainings that are required annually, like CPI, which is the de-escalation training that's required to bills code. So we'd love to host some of those trainings. And then we also do statewide quarterly, like 988. We have the state group work together, and I would love for Sedgwick County to be able to host rather than having to travel all of the time to the other centers to go to those. So there are a lot of opportunities to be able to have trainings and meetings within our center. And then to showcase some of the work too. So right now we have to go next door to, I think the sheriff mans that one, previously the CDO, because they're the largest training room in the area right now.
Okay, thank you.
Now,
Thank you, Mr. Chairman. I get the cart before the horse here, but I just wanted to ask a couple questions on the mental health entrance for the county. You talk about security measures on that side. What type of security measures are we talking about? Just like we have a ComCare today, or something more significant?
On this portion of the building,
Right.
There's an added vestibule. Right now, they push a button on the outside. So it does allow a little bit of privacy because they do share their name and sometimes date of birth because we look them up to make sure that they don't have any flags and are safe to allow in the building
Are they
before.
scanned for weapons?
And we ask about weapons, and then we are hoping that there's no metal detectors, if that's what you're
That's what
asking.
I'm asking.
There aren't any of those. It depends on the level of security that we have and whether or not, because our concern now with metal detectors is once they identify as having a weapon, what do we do with them? Because we're asking them to
Right.
take them out and store them.
It's a whole nother, it's a whole nother topic.
Whole
When
nother
we get to
topic that we
So
need to get
employees
to.
have right to defend themselves as well.
Mhm.
Both the school has specific law that deals with security, what you can and cannot do in schools, and unless they have security measures, students and employees have the right to defend themselves to their cars, to the parking garage, even within the facility, unless you provide security measures. And if you are going to provide security measures, you might need to find a way for them to have protection from the front door to their car. That's a whole nother discussion. And on this side, you can by law prohibit this, but without real security measures in place, you're just on the honor system here. So I just think, considering where this is located downtown,
Mhm.
I think it's a topic, and I don't see anything in the plan right now to address that issue that I think is adequate. So and again, I looked at the drawings today, but I don't know that this is really necessarily the way I'd like to see it. So.
Safety is something that we are having an ongoing discussion, and we do plan on talking about the future of security and the community crisis center and what that would look like. So it might not be a heavy conversation as far as design of the building, but we've talked about everything that we can have control as far as design of safety, access, and screening to the best of our ability. But we do look at security and what that future looks like, and we're talking about it.
Okay. And one other option, I think you showed an employee entrance, a separate entrance for employees. Again, that also creates another opportunity where that's addressed specifically in the law, that employees who have their own entrance are not subject to any security measures that you might introduce for the general public. So if they have their own entrance, they're exempt from that law. They're allowed to carry their own firearms into the building if they're an employee.
Commissioner, I might just add, this doesn't directly talk about what you're indicating right now, but we did have the sheriff's office review the schematic design, and then we incorporated what their recommendations were into the plan.
And I love our sheriff, but I'll just say this: I know the state law on this pretty well, and as we design buildings, public buildings, I've talked to our schools, for example, and encourage them not to have employee entrances. There should be an employee entrance that you can go out in case of an emergency, but they shouldn't be a place for employees to come in because it creates a vulnerability. I appreciate the review, but it needs to be thought through that everyone has a right to defend themselves. And unless you provide security measures, and it has to be in accordance with state law, then we have to understand that signs and an honor system doesn't really provide security.
So to speak to the employee entrance, when that was originally designed, it was for egress purposes only. And the conversation evolved to there's parking right outside that door. And so it has the ability to be, it'll be on a badge reader. So we'll have the ability to only have that for egress only, depending on how the conversations go regarding security, or open it up to employees.
And that's the same thing schools talk about. Well, the entrance is on the backside of the building where the teachers are parking. In my opinion, is the teacher should walk around the building and come in the secure entrance. The door that's going out to the outside is only for an emergency. It's not to go out and smoke a cigarette. It's not to go out and get to your car quickly, in and out, because it creates a vulnerability. This is a mental health facility in downtown Wichita. We don't need extra entrances that are non-secure. If you're going to have security, then have security. But don't pretend that a entrance out to the parking lot is going to create anything more than convenience, which creates vulnerability. I just think it just needs to be thought through.
Very good. Okay, would you be able to get me staffing numbers of how many staff would be in that building? And would you be able to just email me? Where's staff in the park? I think that's a big discussion that if you can just email me those things, that'd be helpful. So.
Chairman, one more thing, since there's a connection between the two buildings, if you are going to create a secure side on our side, you need to deal with the security between the two buildings as well. Thank you.
Thank you so much. Doug, thanks for coming. Jennifer, thanks. Really appreciate all the work, Andrew, everybody, your teams are putting into this. So, okay. Tom, next up.
Let's, Tom, if you could come up to the podium and kind of talk about what the agenda item for tomorrow is going to look like, so the commissioners are aware.
Good morning. Yeah. Okay. Good morning, commissioners. So tomorrow you're going to have before you two alternative resolutions with how to address quality of life spending, which is going to be defined in both of these resolutions as it's discretionary spending that's on recreational or for the enhancement of quality of life of Sedgwick County residents. And the thought process behind the initial resolution, which was brought forth by Commissioner Howe, was to allot the existing sales tax dollars towards this quality of life spending. And as we kind of got into it and discussed this with your CFO, Lindsay Poe-Rousseau, and others, functionally, it's been developed into a cap that is based on a look back of 2 years, so that we're not having to, because of the delays in collection of sales tax dollars, and that we're not going to have issues with delays in funds. So it's setting a limit on the amount of dollars that can be spent on the quality of life spending as defined in the resolution. When this was looked at by the previous commission, there were a couple of exceptions included for discretionary spending or the quality of life spending. The first was for economic development. The second was for capital improvement spending and that's specific to Sedgwick County owned property. So those are not included in the dollar amount that would contribute towards that cap in House resolution that he had initially put forth. So the sales tax dollars we collect, we currently collect 1%. Half of that is allotted to roads and improvements in that regard. That is not addressed by this resolution. The other 0.5% right now is designated for property tax relief. This essentially creates a clear definition of what that property tax relief and what those dollars are being allocated towards. And then there is an alternative resolution that has been put forth alongside Commissioner Howell's. And what that essentially says is at a public hearing, the commissioner is going to have a chance to address what they would like that quality of life spending number to be. There is no limit on it. It can exceed the 0.5% sales tax collected for property tax relief or not. And that's really going to be determined by the board every year in the early part of the budgeting process. So with that, I'll leave it open for questions if you have anything for me, or if the commissioners want to address their own resolution. So
I think, when this last was discussed at the former commission meeting, I had mentioned that I hadn't fully understood. And so I think it'd be beneficial if Commissioner Howell wants to explain his reasoning, and then I'll explain what I did after looking at it further, if that's all right.
Chairman, may I continue? So I think this has been mischaracterized a number of times, and I want to just clarify a couple of things off the beginning here. This is really a prohibition on using property tax dollars in discretionary ways for these types of spending. And there's a number of things listed specifically in the resolution, I think, for clarity. But the principle behind that says that we're not going to levy people's property tax dollars and then fund these specific entities. And I think others that are like them, that list may need to be adjusted over time, but these are specifically listed in here for, I think, for clarity. I'll ask a clarifying question. Can we use sales tax dollars, not the 50% for infrastructure, which I'll argue is still property tax relief, by the way, because we would take care of our roads and bridges if it wasn't for that revenue. So the only way to do that, take care of roads and bridges without that revenue would be through property taxes. So we've reduced property taxes because we have a sales tax revenue to do some of that work. Outside that 50%, could we use property or sales tax dollars to fund things like the election office or the sheriff or a bridge for that matter, for any type of spending within Sedgwick County? The answer is yes. There's no limit on the use of sales tax dollars. That's not what this does at all. So this is not a limit on sales tax dollars. This is a limit on property tax dollars. And it says that you cannot use property tax dollars. There's a couple of caveats. There's a couple of exceptions listed in the resolution, but we said we should not use property tax dollars for things like Exploration Place or the Kansas African American Museum or our parks, for example. And there's a number of things listed there. One of the arguments was if Interest Bank Arena needs a new roof, can we use property tax dollars under my resolution? The answer is yes. Look at section 1. It says at the end there, capital improvements spending on Sedgwick County owned property shall not be considered quality of life spending. So what that means is you can use sales tax dollars, or you can, it's permissible under my resolution to use property tax dollars to put a new roof on Interest Bank Arena. That's a discretionary decision on how you want to fund that through the county commission. But can you use sales tax dollars? Yes. Can you use property tax dollars? Yes. You're not limited. The dollars from property taxes, I should say from sales tax dollars, will fund our employees first because we have 112.5 FTEs, I think, at the zoo. That are Sedgwick County government employees. So we fund those first because they are our obligation. That includes their salary and their benefits. So we would take care of them first, and then we would pay for, again, let me just say it this way. To the extent that there are sales tax dollars available, we have the discretion to spend those sales tax dollars on these types of spending, these specific things and other things like them. So to the extent there's sales tax dollars available, they can be spent. Are they earmarked specifically for that? No. Nothing in my resolution says you shall spend $19.6 million this year on these things and nothing. You can't, in other words, can you fund the election office? It's not part of these quality of life things. Yes, you can. It's not saying that every sales tax dollar must go to quality of life. That's not what it says. It says we have discretion to spend those sales tax dollars on quality of life. You can also spend sales tax dollars on non-quality of life or functions of government. The only thing it really does is puts a cap on property tax dollars. It says when you run out of sales tax dollars, if you want to spend property tax dollars on these things that are not employees and not capital, we've got a guardrail in place. It tells us by policy, by philosophy, by the way we run our budget, we're not going to spend property tax dollars to, again, I voted for all these things, but if say Exploration Place came back and said they want another $2.5 million for some other next project, and we're out of sales tax dollars, we would be able to say then, we don't have the sales tax dollars to fund that idea. It's already earmarked for other things. It's not really available to be spent that way. We can't just go to our ending balance that we carry in our budget and say, we're going to deficit spend some money that came from property tax dollars and give it away to someone for a really great idea. It gives us a guardrail not to do that. It gives us right to say no. When I have asked people in the community, do you want a guardrail in Sedgwick County that says we cannot spend your property, and I use the word precious, your precious property tax dollars on discretionary spending, things like these. These are all great things. But do you want to have a guardrail in place? I have heard almost exclusively absolute support for that policy. And I'm going to tell you right now, when we go to the legislature, hopefully tomorrow, and I argue about property tax dollars, the very first thing it said to me last year and the year before that and the year before that, when this conversation continues coming up, is you guys just gave $2.5 million of property tax dollars to Exploration Place. And I supported that. I did. And it was a really good thing we're doing. but they're upset because they feel like we're overtaxing the people and giving it away. And that's why they're offended by it. They're going to pass law to clamp us down because of that exact decision and decisions like that. And that's why I'm trying to send a message to Topeka. Hey, we don't tax people out of their homes for things that are not absolutely imperative to running Sedgwick County government, elections and sheriff and jail and streets and bridges and human services and administration like finance and HR and purchasing and fire trucks and ambulances and 911. All those things are core functions. We're not taxing people out of the home for those. Again, we are trying to tax people out of, not trying to tax anybody out of their home, but to the extent we're levying taxes, it's for those types of things everybody seems to support. When I say it's for someone to have a lower ticket price to one of these venues, they get pretty upset when they're being taxed out of their home because a lot of these folks do not get to enjoy Interest Bank Arena. They do not get to enjoy Sedgwick County Zoo. And so the point of this is by going to sales tax dollars, which was voted in by the people, those dollars can support those things, which, by the way, turns back around, makes it where they can thrive and creates more sales tax dollars. It seems very appropriate. That's all my resolution does. It doesn't really, by the way, it's a soft resolution. It's not as soft as the other one, but it can be rescinded. It can be amended. It can be jumped over for that matter, because it's not a law. We can simply not, the state of Kansas says, notwithstanding the state law that requires 7.5% any melts, we're only going to have 1% this year. It's a guide, and we should live with a guide. It gives us a legal and legitimate reason to tell someone we cannot provide our ending balance in our budget. We can't just hand it out like it's available because we don't have the authority with the guardrail in place. That's all this does. Thanks.
Schmeiser?
Okay, thank you. Thanks for the explanation, Commissioner Howell. I understand the purpose. I think the main message, if I understand right, was to send a message to Topeka that we're being responsible and to the fellow constituents. And but the net effect is to the same constituents and to the same legislator is that this doesn't reduce anybody's property tax bill. If we'd have had this in place last year, it would not have impacted this year's property tax statements that everybody receives. Is that correct?
From the numbers we've seen, yeah, that wouldn't have affected what we allotted to these types of spending.
But it is guardrails and it sends a message, which I agree pretty much with it, but I'm not sure the real impact is anything of tremendous value other than it's a statement. If we go forward, and that's why the version that I helped define was basically twofold. And one is, if we're going to quote citizen issued sales tax items, I think we need to be fully transparent. And that's why I added a couple of the other whereases. We're talking about any and all voter referendums related to sales tax. And so that's why I put those whereases in there, the extra 1, 2, 3, 4. And so that was mainly just to be fully transparent with this bill or this resolution for the media and the citizens to understand. That's the first of two considerations that I adjusted. And the third one, or the second one was, I think we've all visited in a way with our finance. And I was really concerned about, we're so proud of our AAA rating and everything that accomplishes that AAA rating, which includes pretty extensive outside audit from the credit rating agencies. And something like this might cause them to question, or at least cause finance to take another handful of steps to explain and whatever. I'm concerned about. I just don't want to jeopardize our financial, whatever you call it, our glowing financial AAA plus rating. So, Lindsay, I don't know if you want to explain that further. Maybe I didn't explain it totally correctly.
No, I think you explained it well, but I'm happy to clarify what happens. So when we've talked about this in the past, I think the concern I have is the money in the general fund is generally a pot. We aren't able to allocate it specifically to certain things because it is all in a pot. But when we go through our financial audit, we have to disclose any new resolutions or policies that were imposed. So we'll have to speak to this, potentially add it in a footnote, and clarify that this happens. And then, of course, following up with our credit rating agencies, as you know, we're about to have a bond issuance later this, you'll approve it later this week. It will happen in early March. We'll have to go through a credit rating analysis with S&P so that they can either reaffirm our AAA or change it. Every time we go through that, plus anytime we do an annual evaluation with them, we have to talk about the flexibility of our revenues. And that's standard. It's not just Sedgwick County that does that, it's anybody. And so one of the things that we had to talk about when we had our self-imposed mill levy rate target was that the governing body had taken action to restrict the flexibility of revenues and to restrict the amount. And so that's something that we will always have to produce and clarify. And I realize that Commissioner Howell says it's just a simple amendment to change a resolution, and it is, but that would take governing body action. That's not something that staff has the discretion to do once a resolution is passed. And I know that I see you want to argue with me on that, so I'll defer to you and Justin here in a second, Commissioner. But that's kind of where the concern comes in, is that and I wouldn't, not overly worried. We will comply with whatever the commission tells us to do. So I don't see there as a real risk. But again, it's just that matter of we're tying our own hands. And that's always something that looks different compared to what other local governments do. And now I'll shut up and let Commissioner Howe speak.
Well, okay, and I'll just close and then you can respond if that's all right, Commissioner Howe. Okay, so with those two things in mind, and with between transparency and the credit rating concern, I thought then in closing, the section 2 basically dictates to the commissioners that when we start the budget process in an open meeting, we determine basically what Commissioner Howell's referendum is, that we will keep the budgeted amount of quality of life would or would not exceed the pledge amount received by the county. So it's kind of a combination of the previous section 2 language plus some corrections to that. So it would basically instruct the commission to start the budget process with that open meeting declaration. So that's kind of explain. I think, Tom, did I miss anything on what the objectives was? And in due respect for the efforts for Commissioner Howell on that, and I just thought this would be a little more flexible and not quite as stringent. So, thank you.
Thank you, Chairman. Thank you for the chance to, I guess, clarify a couple more things and respond to that as well. If anybody is listening, just want to make sure they understand, I'm not advocating in this resolution for any new sales tax, but it is addressed in my resolution, which I don't know that it's addressed in the Commissioner Meister's version, but towards the end of toward my section 4, it says if any new sales tax is approved by legislation and by Sedgwick County residents for quality of life spending. Now, there's a discussion about potentially creating, if you will, a voter approved dedicated revenue stream for quality of life. And it's a whole nother discussion, but if that was to happen, it says that this resolution shall cease and the existing sales tax dollars we already collect shall apply directly or generally to ad valorem tax relief. In other words, property tax relief. So that makes, hopefully it makes sense to everybody. There's no in this resolution, there's no dedication for proper sales tax dollars to specifically fund these things. It only allows for their consideration to be used for these types of use. Second of all, I don't think this is just semantics. I know Commissioner Dennis and I argued back and forth. Is this just semantics? And without using that word, I think Commissioner Meister kind of alluded to the idea that it doesn't really change the property tax liability. Maybe not today, but that day is coming. And if you don't believe me, listen to the legislature. They're going to start cutting property taxes. They're going to start putting pressure on us to lower mill levy rates into assessment caps. It's coming. We're going to be stretched pretty thin on the property tax side. And I would really, and as I've said before, and they came to us last year, we talked about, they sat in the audience during the budget adoption. I implored them, please move your revenue stream to sales tax. It's the only way really to guarantee that you get something, because right now, property tax dollars, if I've got if I don't know how you all feel about this, but if we have to make a decision between the sheriff and the zoo, I know where I'm going to be on that. I love our sheriff and I love our zoo, but I think the sheriff wins. Has to, because it's public safety and it's a priority. So if that decision ever comes, the zoo's going to be seriously having a difficult time out, advocating for revenue stream if that decision ever comes. And that decision, that pressure is coming at us, whether you like it or not. We're going to have start making some very difficult decisions. And I think to the legislature, I don't think this is just semantics. Right now, you're right. It didn't change the property tax bill this year because we have sufficient revenue in our sales tax funds. And we actually have more than we need to fund all these things. There's actually money left over, which goes to fund other core functions of government. Okay. So we have surplus of sales tax funds to fund all these things to our choices this last budget cycle. But that could change in the future as well. And I think I don't think sales tax is ever going to go to zero. It's going to be always revenue there. It might ebb and flow. One of the things I talked about was if there is a blossoming economy, if sales tax revenue goes up, it creates more dollars. We can have discussions about what to do with that. If the economy goes the other way and we go into a recession, then we have to tighten our belt here in Sedgwick County, but our partners will also have to tighten their belt too. It's only fair. Back in 2015, when I first got here, we had a budget shortfall, and these entities, very same entities, were demanding to be funded with increases. And right before that happened, we laid off sheriff's officers. We did. We reduced the sheriff's office and provided a funding increase to these very same organizations. So that's reality. Let's go back to the AAA bond rating issue. I don't know that if someone wants to downgrade us because we're being fiscally conservative and we have guidelines and principles we live by, I'd be shocked by that. I think you have to disclose it. Did we lose our triple bond rating when we had a mill levy target? Did not. And by the way, if you don't know what that is, every year we start a budget cycle. We start with last year's technically adjusted mill levy and start building the budget from that number. It's just a number. Wichita claims they haven't raised their mill levy in 20 or 30 years. But it's funny because their mill levy's gone up several mills. How did that happen? Well, because they had technically adjusted mill levies, that they captured that. And they started the budget process the following year with a corrected mill levy number. So their mill levy has gone up a couple of mills. And so what we did is we targeted 29.359. And for about 10 years, we stayed there. We built our budget based on a target mill levy. And it was a conservative way to go forward. And since then, we lowered our mill levy down. Was it 28.988 now? Or even lower than that now? It was last year's 28.988. It's gone down. We don't need 29.359 any longer. But that was useful while we were tempted to go up in mill levy. It gave us a goal to be more conservative. So if that, I still don't think that was a bad resolution. While we needed it for 10 years, we kept our mill levy flat. Had not been for that mill levy target, we probably would have increased our mill levy a little bit each year and probably would have climbed up. And so we would have spent the money. It was a conservative thing to do. So people might not like that type of management, but I think to be conservatively principled and try to do things that are conservative is what we're called to do. At least as elected officials, at least I am called by people to say, be as conservative as you can be and how you spend our money. So with that, I think the resolution, again, I appreciate Commissioner Meissner's, but my opinion is it's a little too soft because it doesn't really create an absolute cap on how we would spend property tax dollars and sales tax dollars. To me, it goes back to a discussion and it talks about I believe his talks about there's consensus to do whatever you want to do. Basically, there's no real guardrail. You can do whatever you like. As long as you have a discussion and you decide to move in one direction, you guys can do that. There's not really a guardrail kind of constraining you. To me, I think the constraint is what we need. That's why I'm asking for us to pass this. And again, if we lose our AAA bond rating, we find this is too difficult, we can always come back next year and change it. It doesn't mean we're stuck with this forever. This is a self-imposed guideline for us to live with. I think it's good to have conservative goals. So again, with that, I would really like to see the resolution move forward.
Okay, thank you, Commissioner Goodlaw.
I get a clarification from legal. Does either one of these resolutions alter, modify, or change the
So the original 0.5% that we're dealing with was allotted to property tax relief. This is just further defining that. So these all relieve property tax based on what's spent in our budget anyways. So it's just a further narrowing down of the scope of what that means.
Can I add, but the referendum on that sales tax vote did have specific language in it for roads and bridges on the other.
Yeah, and that's the other 0.5%. So this doesn't address that other 0.5%.
Right.
So this is basically taking what we normally would have in property tax reduction or split it out. We're utilizing those funds for items that we would normally pay with property tax, right?
Well, and just to be clear, the way that it's drafted is it sets a limit on the dollar amount that we can spend for these types of functions. It's not actually earmarking specific dollars for specific things. Setting a maximum amount that you can spend, yes.
Good questions. Anything else? Okay, Tom?
All we have, sir.
Okay, I think we're good. See you guys tomorrow. 9 a.m.